We've seen the uptake of immuno-oncology drugs as just unbelievable over the last 5 years in the community oncology setting. And what we've seen is that, to our delight, the trial evidence has largely translated into the same type of meaningful improvement in patients' lives that we saw in the clinical trials by using IO. Of course, IO now has so many different indications, it's a bit hard to keep track of. But what we're seeing in terms of efficacy and in terms of delivering IO in the community largely mirrors the clinical trial experience. However, we are seeing more adverse events related to immune reactions than one saw in the clinical trials, probably related to the fact that we're using a broader patient base. So those that perhaps have some history of autoimmune disease or have had some other characteristics that wouldn't allow them into a clinical trial. And we're also seeing late adverse events. So one of the things we've learned is you've got to follow these patients very carefully, sometimes months or years after they start their therapy, because those adverse events can crop up later.